are the primary tools through which we interact with our world. They allow us to perform basic acts of self-care, such as buttoning a shirt, holding a fork, and writing. They are instruments of complex expression, to paint or play an instrument. In occupational therapy, hand function is central to meaningful occupations. When hand function is compromised, independence, productivity, and quality of life can be significantly impacted. Understanding hand conditions is fundamental for aspiring occupational therapists. Carpal tunnel syndrome is one of the most common conditions you will encounter. It arises from pressure on a key nerve in the wrist. Think of it as a traffic jam within a narrow tunnel in your wrist. When the tunnel becomes crowded, it squeezes the median nerve. This compression produces symptoms ranging from mild to debilitating. It can interfere with typing or gripping a steering wheel. This masterclass will give occupational therapy students a foundational understanding of carpal tunnel syndrome. We will cover causes, symptoms, and the role of occupational therapy in management. By the end, you will be better prepared to assess and treat clients, develop client-centered plans, and support functional recovery. To comprehend carpal tunnel syndrome, we must visualize the anatomical structure it's named for. The carpal tunnel is a narrow passageway on the palm side of the wrist. It is formed by carpal bones below. Small carpal bones create an arch on the bottom and the sides. Spanning the top is the transverse carpal ligament, the roof of the tunnel. The structure is rigid and does not stretch easily. Through this confined space travel 9 flexor tendons and one very important nerve, the median nerve. Think of tendons like ropes connecting forearm muscles to the fingers and thumb. They allow fingers and thumb to bend and grip. The median nerve provides sensation to the thumb, index, middle, and half the ring finger. Thumb, index finger, middle finger, half of the ring finger. It also sends motor signals to the thenar muscles at the thumb base, essential for pinch and grasp. The close proximity of these 10 structures in a fixed space is the core problem. Carpal tunnel syndrome happens when the tunnel space becomes smaller or its contents swell. That increased pressure most affects the median nerve. Imagine 9 bulky passengers, the tendons, and 1 delicate passenger, the median nerve, on a crowded bus. If swelling crowds the bus, the delicate passenger gets squeezed. That compression disrupts signal transmission to and from the hand, producing the symptoms clients report. Symptoms almost always follow a predictable pattern related to median nerve function. Clients often report sensory changes first. Vague tingling, numbness, pins and needles, paresthesia is common, typically in the thumb, index, middle, and half the ring finger. Symptoms often wake clients at night. Many sleep with wrists bent. As compression worsens, symptoms go from intermittent to constant. Numbness and tingling may be joined by burning pain. Pain can radiate up the forearm and sometimes to the shoulder. Clients may report clumsiness or weakness, dropping objects more often, like a coffee cup or keys. Motor impairment begins when chronic compression affects thenar muscles. In advanced cases, you may observe thenar wasting, flattening below the thumb. Fine motor tasks, buttoning, picking up coins, using zippers, become difficult. Recognizing risk factors helps with prevention and early intervention. Anatomical factors. Some people are born with a smaller carpal tunnel. Women are about 3 times more likely than men to develop carpal tunnel. Certain occupations with repetitive wrist flexion increase risk. Forceful gripping and vibrating tools also raise risk. Systemic conditions, diabetes, thyroid disease, rheumatoid arthritis, pregnancy, and obesity are important contributors. Occupational therapy management is multifaceted and client-centered. OT intervention focuses on restoring function in daily occupations. The first step is a thorough evaluation. Assess symptoms, pain levels, and how the condition affects life roles: parent, employee, hobbyist. Standardized tests measure grip and pinch strength. Sensory testing maps areas of numbness. Provocative tests like Phelan's and Tunnell's help confirm median nerve compression. Tunnell's sign is a useful provocative maneuver. A holistic assessment informs a tailored intervention plan. A central conservative treatment is provision of a wrist splint or orthosis. A cock-up splint is often provided to be worn at night. It holds the wrist in neutral, the position of least pressure. Preventing wrist flexion during sleep allows the median nerve to rest. Many report reduced nighttime symptoms after splinting. OTs ensure proper fit and educate on wearing schedules. Ergonomic modification and activity analysis are central to therapy. Identify tasks that exacerbate symptoms: posture, keyboard height, tool use. Recommend adjustments such as ergonomic keyboards or technique changes. Therapeutic exercises, nerve and tendon gliding, help mobility within the tunnel. They encourage the median nerve and flexor tendons to move more freely. Gentle ROM, soft tissue work, and improved circulation can break minor adhesions. Strengthening is avoided in acute phases. Prevention is powerful. Occupational therapists are positioned to lead education efforts. Teach proper body mechanics and posture to maintain a neutral wrist. Keep the wrist straight, not bent up or down during repetitive tasks. Encourage frequent micro breaks to stretch hands and wrists. Micro breaks apply to typing, assembly work, and other repetitive tasks. Simple stretches reduce cumulative stress on the median nerve. Recommend tools with larger padded handles to reduce grip force. Alternate hands for repetitive tasks when possible. Advise anti-vibration gloves and avoidance of prolonged cold or vibration. Client education is paramount. Teach recognition of early warning signs and immediate strategies. Empower clients with home exercises and self-management tools. Early action reduces cumulative nerve stress over time. You will see carpal tunnel in outpatient clinics, industrial rehab, acute care, and long-term care. You may perform workplace ergonomic evaluations to prevent injuries. You may work with pregnant clients or older adults with systemic contributors like diabetes. Identifying and addressing carpal tunnel improves outcomes across a diverse population. Carpal tunnel is more than a pinched nerve. It can profoundly disrupt daily engagement. For OT students, mastering anatomy, symptoms, risk factors, and evidence-based interventions is essential. With splinting, ergonomic modification, and therapeutic exercise, clients can return to meaningful activities. Helping clients manage carpal tunnel restores their ability to work, care for themselves, and participate in